Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Me, Dr. Tariq, Obs Gynae Family Emergency Specialist, Gulf KSA internist, and presently a district gynecologist. See, we start Bismillahir-rahmanir-rahim, the CME, with the name of Allah, who is very helpful, kind, and merciful. The topic of CME is very important and is basically, we have already discussed the sexual transmitted disease and is closely related with this topic is pelvic inflammatory disease. Pelvic inflammatory disease is basically the is the infection of the upper genital tract. Though the exact incidence of pelvic inflammatory disease is not known, but it is estimated, and it is thought that it is 1 to 3% of the total, especially in the young woman. The causative organisms for this pelvic inflammatory disease is related to the sexually transmitted disease, which includes the infections from the ascending infection from the endocervix, and then the descending infection from the appendix. And then there are other STD related infections like chlamydia and gonorrhea. While there is other elements are also there, this anaerobes and endogenous agents, aerobes and facultative one, which are responsible for this. The most important thing is to take a full gynecological history, menstrual history, obstetric history, and in the gynae, the history of smears and history of discharge and history of investigations like high vaginal swab, and most important is the smear history, contraceptives history, and also this any pelvic surgery, especially instrumentation and termination of pregnancies. And in the sexual history, this is most important, is the history of last sexual contact, history of partner, recent partner, and STI in the partner, and the multiple partners and the concurrent partners. So this is important, as this they are mostly involved in the commercial sex industry, and they are basically IV drug abuse and also blood-borne viruses diseases like hepatitis B, C, and HIV, also very important. And then these histories are important. History of contraception, history of these drugs, history of insertions of IUCDs, and history of oral contraceptive pill. And then we have to have details in the sexual history, which already has been mentioned. Now, what are the risk factors? The risk factors are the sexually transmitted disease, and basically, especially in the young ones, and the multiple trans partners, and the STI in the partners, and also this surgical instrumentation in termination of pregnancies, and surgical intervention, and the termination of pregnancies, instrumentations, and other sexually transmitted disease like especially chlamydia and gonorrhea, and postpartum endometritis, and all these are important. There are some protective effect by COCP and Mirena uterine system, LNG system, IUCDs, and COCP and Mirena instrument IUI-LNG system, they have some, and progestogens, they have some protective effect for pelvic inflammatory disease. Now, regarding the signs and symptoms, it can be varied, but mostly there is uh, lower abdominal pain and chronic pelvic pain. There is dysmenorrhea, there is dysuria, there is IMB, PMB, intermenstrual bleeding, and postcoital bleeding. There is offensive, foul smelling discharges, or any change in the discharges is very important. And then we have to screen out and have to see, test for these. Okay, what are the sexually transmitted infections like chlamydia, like human papilloma virus, like gonorrhea, like herpes, like syphilis, and HIV. So there could be fever as well, there could be discharge, there could be irregular menstruation, there could be irregular bleeding, and there could be pain, chronic pelvic pain, and temperature also. So, and discharge, and all these symptomatology of the pelvic infections. Then we have to see the detailed history, examinations, and in examination you have to do the per abdominal examination. You will find the tenderness, rebound tenderness, and sometimes there is whole localized peritonitis, and can convert into generalized one. And then there is cervical motion tenderness in the pelvic examination, and per speculum examination, the quantity color association relationship, and the offensive color of the smell of the discharges, blood stained discharges, purulent discharges, pussy discharges, all are related to it, especially when they are going to have a pelvic abscess. There is cervical motion tenderness, bilateral tenderness, sometimes urinational tenderness, and there is tenderness in the adnexa as well. Pelvic tenderness, cervical motion tenderness, and adnexal tenderness. The investigations are for the sexually transmitted disease, especially for the gonorrhea and the chlamydia, and for the syphilis, and though it is rare, and for herpes, and also WBCC and CRP, and also we have to find out the PCR for the vesicles for herpes, and syphilis for Rhygenic antibodies, and VDRL, and like this. And then comes the ultrasound, transvaginal ultrasound, and laparoscopy. But laparoscopy is an invasive procedure and should be restricted when we are suspecting the pelvic abscess. And then comes what are the complications of the pelvic inflammatory disease and sexually transmitted disease. As I already mentioned, that dissemination of the infections, systemic infections, and also subfertility. Rather, these pelvic inflammatory diseases are being discovered when we are screening for pelvic inflammatory when we are screening for subfertility. So endometritis, and especially the postpartum one, and ectopic pregnancies, and tubal blockage, and subfertility, leading to subfertility, and endometritis, and pelvic abscess, and sexually transmitted disease, and pelvic infections, and pelvic abscess, which needs laparoscopic plus drainage also for this pelvic abscess. The endometritis, subfertility, pelvic infection, ectopic pregnancy, tubal blockage leading to ectopic pregnancy and systemic infections, and to other urological and gynecological infections. Now, what are the treatment? Treatment is basically the healthy lifestyle, increase more water and walk and exercise, avoid stress leads to distressing, as leads to distress and the diseases, and uh, important are to use the barrier contraceptions and sometime and the use of COCPs and for irregular menstruation, and to avoid restrict the partners, recent partners, and the travel histories. There could and also be having incidents and attacks of abuse and sexual abuse. So the treatment is we have to give the outpatient treatment and the inpatient treatment, but we have to see the response of the treatment in 72 hours. If the patient is deteriorating, if the patient is not responding, and if the patient needs inpatient admission, and if the severity of the disease is going up, pain, swelling, tenderness, and excitation, and this all symptomatology has to be decided, especially for the pelvic abscess, when it is needed to have an ultrasound and laparoscopy to drain the pelvic abscess. And then it is very important to monitor the response and the culture sensitivities and the type of, since we have to, sometimes the test results are negative, but early treatment is mandatory in order to avoid the damage. Now comes the outpatient treatment, and we can have to use a combination of drugs covering all these organisms like facultative aerobes, anaerobes, and chlamydia, trichomoniasis, trichomonovaginalis, herpes, and all these. So a combination of all these antibiotics, broad spectrum, gram positive and negative, and like for example, and if there is abscess, that has to be drained by through laparoscopy. And then oral combination, this outpatient treatment is ceftriaxone, cefoxitin, IV doxycycline, and then oral doxycycline and oral metronidazole for 14 days. And then the other combination also, injection ceftriaxone and injection IV doxycycline and oral doxycycline and metronidazole for 14 days. And then oofloxacin, quinolones, and metronidazole and doxycycline, and they are also given in combination for 14 days. Now, inpatient treatment is carried out with the, for example, injection ceftriaxone, injection IV doxycycline, and injection then metronidazole and IV, and then oral doxycycline and metronidazole for 14 days. And then injection clindamycin and injection gentamicin. Loading dose is 2 per, and then it can be 1.5 per kg it is given. And then oral metronidazole, doxycycline, and clindamycin, like 450 milligram QDS, and this doxycycline BD, metronidazole BD for 14 days. And the other combination also of oofloxacin, quinolones, doxycycline, and also this metronidazole for 14 days. So partner treatment is very important. Contact treatment is also very important because it's a in order to prevent the recurrence. Notification, contact treatment, tracement, and social support and counseling and barrier protection are very important. So we'll come with another review. Thank you very much for the patients listening, and we'll come with another review. And by that, our takeaway is pray, praise, trust, love, worship Allah, follow Sunnah sallallahu alaihi wasallam, peace be upon him, darood un par, our health and the lifestyle, our health and survival, and we must not forget our glorious past. Allahumma ajirna minan nar, wa kufa billahi wakila, wa kufa billahi nasira. Subhanallah wa bihamdihi, subhanallah al-azim. Ala bi zikrillahi tatmain qulub. And we always should ask and pray and love, worship, trust, and have full confidence in Allah, and always ask from Allah. हम तो माइल बकरा में कोई साहिल ही नहीं, राह किसे दिखलाएं, राह पर मंजिल ही नहीं। दो नीम इनकी ठोकर से सहरा और दरिया सिमट कर पहाड़ इनकी हैबत से राय। We'll come. Thank you very much. Best of luck. We'll come for another review. Till that, Khuda Hafiz. Wama alayna illal balagh.